Welcome to Chill Medico NEET UG, your guide to MBBS in the medical field. Learn and explore the world of medicine with us. Today's topic: MBBS course breakdown. Starting your MBBS journey can be exciting, especially when you are trying to figure out what to dive into for anatomy. Don't worry, you are in the right spot. Anatomy is a major player in your first year, and I'm here to break it all down for you, step by step. First things first, let's talk about gross anatomy, the biggest part of anatomy. It's all about exploring the body region by region. Here's what you'll want to focus on: the upper limb, muscles, bones, joints, and the famous brachial plexus. The lower limb, blood supply, nerve supply, and important joints like the knee. The thorax, the heart, lungs, and mediastinum. The abdomen, digestive organs, the portal vein, and pelvic structures. And let's not forget the head and neck, where you'll really dig into cranial nerves and brain anatomy. To help you out, I recommend checking out BD Chaurasia's Anatomy in Grant's Atlas of Anatomy for some awesome visuals. Next up is embryology, which is all about how our bodies develop. Get ready to learn about general embryology, fertilization, implantation, and the formation of basic layers. Systemic embryology, the development of organs and anomalies like congenital heart defects. For this, Inderbir Singh's Embryology and Langman's Medical Embryology are your go-to books. They'll give you super clear concepts. Now let's zoom in on histology, which focuses on the microscopic world of anatomy. You'll explore basic tissues like epithelium, muscle, and bone. Histology of organs like the liver, kidney, and heart. Inderbir Singh's Histology and De Fiore's Atlas of Histology are great resources for this, especially for clear diagrams and understanding. Get ready for neuroanatomy, a fascinating but sometimes tricky subject. You'll delve into the brain structure and lobes, cranial nerves and their pathways, the spinal cord and its tracts. For this, I recommend BD Chaurasia's Neuroanatomy or Snell's Clinical Neuroanatomy if you are interested in the clinical side of things. Now, let's not forget about dissection. This is where you get to put all that theory into practice. Cunningham's Manual of Practical Anatomy will be your trusty guide during dissections. Seriously, it's a game changer for learning anatomy. A few other key areas to focus on include surface anatomy. This is all about connecting structures to external landmarks. Radiological anatomy. Get ready to identify organs in X-rays, CT scans, and MRIs. And don't forget to start with general anatomy, which covers the basics of bones, muscles, and joints. Now, here are a few quick tips to make anatomy a little easier. 1. Don't wait till the last minute. Anatomy is a big subject, so start early. 2. Check out apps like Complete Anatomy for awesome 3D visuals. 3. Grab your pencils and practice drawing diagrams. It's one of the best ways to remember all that info. 4. And try to connect what you are learning to real-life clinical conditions. It'll make everything way more interesting. So there you have it, your roadmap to conquering anatomy in MBBS. It might be challenging, but remember, it's the foundation for understanding medicine. Just stick with it, and you'll be amazing. Next, physiology. Right, it's crazy interesting and super important for your first year of MBBS. Want to know what to study? I got you covered. First up, general physiology. It's like the foundation of the house. You got to know about cell membranes and how stuff moves in and out of cells. Then there's homeostasis, which is how your body keeps everything in balance. And don't forget about how cells talk to each other with stuff like resting membrane potential and action potential. These are the basics, and Ganong's Review of Medical Physiology or Guyton and Hall Textbook of Medical Physiology are your best buddies for this. Next, let's talk about blood and the immune system, pretty important stuff. Learn about what's in your blood and what it does. Get to know your RBCs, WBCs, platelets, and that hemoglobin that keeps you going. Oh, and don't forget about how your blood clots and how your body fights off infections with inflammation and immunity. Pro tip: use diagrams and flowcharts. Trust me, it's way easier to remember that way. Now for the heart of it all, the cardiovascular system. Get a grip on how your heart muscle works, how your heart beats, and how to read those ECGs. You'll also need to know how your body regulates blood pressure. And of course, heart sounds and murmurs, gotta love those. Guyton and Hall will give you the simple explanations, while Ganong dives into the nitty-gritty details. Time to breathe. The respiratory system is up next. Learn about lung volumes and how much air you can actually breathe in. Understand how you breathe, how your body exchanges gases, and how oxygen gets where it needs to go. And don't forget about how your breathing is regulated. This is super important for understanding conditions like hypoxia and hypocapnia. Now, renal physiology. I know, it can be a bit much, but it's crucial. Focus on how the nephron works, it's the functional unit of your kidneys. Then there's glomerular filtration, tubular reabsorption, and secretion, basically how your kidneys filter your blood and make pee. Understanding this stuff is key to understanding kidney diseases. Let's move on to the gastrointestinal system, where the food's at. Learn how your body breaks down and absorbs carbs, proteins, and fats. Get to know how stuff moves through your digestive system and how hormones control everything. And pay attention to clinical stuff like malabsorption syndromes and acid peptic disorders. Next stop, the nervous system. It's huge, but super cool. Learn about your brain and spinal cord, how they're structured and what they do. Focus on reflexes, how nerve cells communicate, and your autonomic nervous system, the one you don't consciously control. And don't forget about how you feel things, move around, and even store memories. Last but not least, endocrinology and reproductive physiology. For endocrinology, it's all about hormones, what they are, what they do, and how they're controlled. For reproduction, learn about the menstrual cycle, how sperm are made, pregnancy, and lactation. These topics come up all the time in the clinic. But remember, physiology isn't just about reading textbooks. It's hands-on. Learn how to take blood pressure, record an ECG, and use a spirometer. Practice your clinical examination skills for the cardiovascular, respiratory, and nervous systems. Then biochemistry comes. Feeling a bit swamped by biochemistry? Trust me, you're not the only one. I'm here to break it down and give you the inside scoop on what to focus on during your MBBS in India. Ready? Let's jump right in. First things first, let's nail the biochemistry basics. Think of these concepts as the building blocks of the subject. Zero in on biomolecules. Get to know the structure and functions of carbohydrates, proteins, lipids, and nucleic acids. Enzymes. Wrap your head around the types, mechanisms, enzyme kinetics, and why enzyme inhibitors are important in medicine. Vitamins and minerals. Learn about their functions, where they come from, what happens when you don't have enough, and the health issues that can pop up. For good reads, check out Satyanarayana and AMP, Chakrapani Biochemistry for clear explanations of the basics, and if you are up for a deep dive, Harper's Illustrated Biochemistry is your go-to. Next up is metabolism, a major player in biochemistry. Here's where to focus your energy. Carbohydrate metabolism. Get a handle on glycolysis, gluconeogenesis, glycogen metabolism, and the Krebs cycle. Lipid metabolism. Dive into fatty acid oxidation, synthesis, and the ins and outs of cholesterol metabolism. Protein and amino acid metabolism. Understand transamination, the urea cycle, and what happens when metabolism goes a bit haywire with inborn errors of metabolism. Nucleotide metabolism. Explore the synthesis and breakdown of purines and pyrimidines. Pro tip: flowcharts and pathway diagrams are your secret weapons here. They'll make studying way easier and be lifesavers during exams. Now, let's move on to molecular biology, a super interesting and important part of biochemistry. Here's what you need to cover: DNA replication, transcription, and translation. How gene expression is regulated. Recombinant DNA technology and how it's used in medicine. These concepts are key to understanding how modern medicine works, especially when it comes to genetics and biotechnology. Clinical biochemistry is where the rubber meets the road, connecting theory with what you'll see in your medical career. Focus on diagnostic enzymes like ALT, ALT, and amylase. Liver and kidney function tests. Understanding disorders like diabetes, metabolic syndrome, and how to interpret lipid profiles. This stuff is super important for diagnosing and managing patients in real life. Up next, we have hormones and endocrinology, which overlaps with physiology. Get familiar with how hormones work, second messengers, and how hormone secretion is controlled. Pay close attention to hormones produced by the pituitary, thyroid, pancreas, and adrenal glands, along with related conditions like hypothyroidism, diabetes, and Addison's disease. And let's not forget about nutrition and metabolism. Important topics include what makes a balanced diet and what your body needs nutritionally. The impact of malnutrition and obesity. What happens to your metabolism when you are starving. These topics are super relevant for both your exams and taking care of patients down the line. Remember, biochemistry isn't just about hitting the books. There's a practical side too. You'll be doing tests for blood glucose, urea, creatinine, and lipid profiles. Urine analysis to check for sugars, proteins, and ketones. Make sure you know how to interpret these test results in a clinical setting. It'll be a huge help during vivas and when you start seeing patients. Now, let's talk books. 1. Satyanarayana and M. Chakrapani Biochemistry. This one's great for clear and concise explanations. 2. Harper's Illustrated Biochemistry. If you are looking for in-depth explanations and helpful diagrams, this is it. 3. Vasudevan Biochemistry. This textbook is specifically tailored for Indian MBBS exams. Choose one or mix and match based on what works best for you. So there you have it, your roadmap to conquering biochemistry in MBBS. Remember, it might seem tough at first, but by focusing on how it relates to real-life medicine and using flowcharts to visualize those tricky pathways, you'll find it incredibly rewarding. You've got this. Pathology, the link between the science stuff and what you see with patients, is super important in your second year of MBBS. Let me break down how to tackle it. Ready? Let's go. First up, general pathology. It's like the foundation for understanding why people get sick. Here's the important stuff: cell injury and adaptation, how cells get hurt, necrosis, apoptosis, and how they change, hypertrophy, atrophy. Inflammation, when things get inflamed, acute, chronic, what causes it, and how wounds heal. Hemodynamic disorders, problems with blood flow like edema, thrombosis, embolism, and shock. Immunopathology, this is about your immune system going a bit haywire, hypersensitivity, autoimmunity, and what happens with transplants. Neoplasia, tumors, both the chill kind, benign, and the not so chill kind, malignant, plus tumor markers and how cancer starts. Robbins Basic Pathology or Pathomer are your friends here. They explain things really well. Next, we've got systemic pathology, where you'll dive into diseases in specific parts of the body. Important areas are cardiovascular system, think heart and blood vessels, atherosclerosis, heart attacks, and rheumatic heart disease. Respiratory system, lung stuff like pneumonia, tuberculosis, and lung tumors. Gastrointestinal system, from your mouth to your peptic ulcers, liver cirrhosis, and colon cancer. Renal pathology, kidney problems like glomerulonephritis, nephrotic syndrome, and chronic kidney disease. Hematology, blood disorders like anemia, leukemia, lymphoma, and problems with clotting. Robbins and Cuttron pathologic basis of disease is the holy grail here, but if you're short on time, Robbins Basic Pathology is a good summary. Now, let's talk about hematology, a section in pathology where you gotta be on your A game. Things to learn: how blood cells are made and what they do. Anemias, different types like microcytic, macrocytic, and hemolytic. Leukemias, lymphomas, and multiple myeloma. Coagulation disorders, problems with blood clotting, and tests like PT, UP, and bleeding time. Knowing these lab tests is super important when you start seeing patients. Clinical pathology is where the theory meets real-life diagnosis. You'll learn about lab tests like CBC, LFT, KFT, and looking at urinalysis. Interpreting blood smears, bone marrow aspirates, and fluid analysis. Here's a tip: focus on how these tests are used to figure out what's wrong with patients. It'll help your tons in your internships and beyond. In pathology practicals, you'll get your hands dirty, not literally, with special stains and techniques. Study up on H&AMP, A stains, Gram stains, PAS, Zale-Nielsen for TB, and immunohistochemistry. Learn to look at tissues under the microscope and spot any abnormalities. Devesh Mishra's pathology practical book is super helpful for this part. Tumor biology is a super interesting area of pathology. Concentrate on what makes cancer cells different, hallmarks of cancer, genetic mutations that cause cancer, like P53, BRCA, tumor markers and why they're important for patients. This stuff pops up a lot on exams and is really important if you want to go into oncology. Okay, let's talk books. Here's what I suggest for pathology. 1. Robbins and Cuttron Pathologic Basis of Disease, if you want to know everything. 2. Robbins Basic Pathology, for a quicker read. 3. Pathomer, awesome for reviewing and making sure you really get the concepts. 4. Devesh Mishra's Pathology Practical Book, for hacking your practicals and viva. Pick the ones that work best for you and how much time you have. So there you have it, your guide to conquering pathology in MBBS. Stay consistent, use diagrams and charts to review, and always think about how what you are learning applies to real patients. Good luck. Let's chat about general microbiology. This section gives you the basics of microorganisms and how they act. but you need to know. Microscopy, different types of microscopes and staining techniques like gram staining, acid fast staining, and others. Culture media, different types of media and what they're used for. Bacterial growth and genetics, growth curve, plasmids, and how genetic exchange happens like transformation and conjugation. Sterilization and disinfection, ways to control how microbes grow, super important for keeping hospitals infection-free. Check out these books, Ananthanarayan and Panikar's textbook of microbiology or Essentials of Medical Microbiology by Apurva Sastry for clear explanations. Next, we've got immunology, a really cool section about how our immune system does its thing. Important stuff here, innate and adaptive immunity, your body's initial defenses and how your immune system learns to fight specific things. Antigens and antibodies, what they look like, different types, and how they're used in medicine. Hypersensitivity reactions, types I through IV with some examples. Vaccines and immunoprophylaxis, how they work and different kinds of vaccines. Autoimmune diseases, the basics of autoimmunity and problems like rheumatoid arthritis and SLE. This part is key for getting how we prevent and treat diseases. Okay, let's get into systemic microbiology, where you learn about specific little critters. Bacteriology, get to know important bacteria like Staphylococcus, Streptococcus, Mycobacterium tuberculosis, and Escherichia coli. You'll want to know what they look like, how they cause disease, what happens when you get sick from them, how to test for them in the lab, and how to treat them. Virology, time to study viruses like HIV, hepatitis viruses, and influenza. And don't forget about new viral infections like COVID-19. Mycology, learn about fungal infections from Candida, Aspergillus, and Dermatophytes. Parasitology, we look at parasites like Plasmodium, malaria, entamoeba, and Ascaris. Make sure you are a pro at lab techniques like culture, serology, and PCR. Clinical microbiology links microbiology to real-world medicine. Things to focus on: healthcare-associated infections, HAIs, usual suspects and how to stop them. Antimicrobial resistance, how resistance happens and what multi-drug resistance means, like MRSA. Antibiotics, how they're grouped, how they work, and what happens when they're used the wrong way. This section is super important for your clinical rotations and when you are actually practicing. Now, let's talk about microbiology practicals, which are a lot of fun and teach you a ton. You'll get to do things like gram staining and acid fast staining, to see bacteria under the microscope. Culture techniques, you'll learn to grow and identify organisms on different media. Biochemical tests, catalase, oxidase, and sugar fermentation tests. Antibiotic sensitivity testing, figuring out how to test and understand resistance patterns. Practicals help you see how the theory works in real life, so pay close attention in lab. Let's talk about general pharmacology. This section is super important because it gives you a basic understanding of how drugs work. Focus on pharmacokinetics, ADME, absorption, distribution, metabolism, and excretion. Pharmacodynamics, how drugs work, receptors, and dose response curves. Drug interactions, synergism, antagonism, and those pesky drug metabolism enzymes. Adverse drug reactions, ADR, different types of ADRs and drug safety stuff. Clinical trials, phases of drug development and the ethics of research. KD Tripaঠি's Essentials of Medical Pharmacology is your best friend if you want a deep dive into the stuff. Okay, moving on to UNS pharmacology, a super important section. Key topics include cholinergic drugs, parasympathomimetics and parasympatholytics. Adrenergic drugs, sympathomimetics and sympatholytics. Neuromuscular blocking agents, what they do in anesthesia and surgeries. Autonomic reflexes, receptors and what they do. Really get to know this section, it's the basis for understanding other systems. Cardiovascular pharmacology is something you have to know for both exams and real-life medicine. Focus on antihypertensives, ACE inhibitors, ARBs, beta blockers, and diuretics. Antiarrhythmic drugs, how they're classified and used. Drugs for heart failure, digoxin, vasodilators, and the newer drugs. Angiotensin drugs, nitrates, calcium channel blockers, and beta blockers. Anticoagulants and antiplatelets, warfarin, heparin, and those new oral anticoagulants, NOACs. Make sure you really understand how they work and how they're used in treatment. Now let's talk about the central nervous system, CNS, one of the trickier sections but really important. Key drugs include sedatives and hypnotics, benzodiazepines, barbiturates, and newer drugs. Antidepressants and antipsychotics, SSRIs, TCAs, and how antipsychotics are classified. Alright, let's explore the captivating world of forensic medicine, where medicine intersects with law and ethics. Whether you're fascinated by crime investigation or aiming to conquer your second year MBBS, I'll guide you on what to study in forensic medicine. Let's jump right in. First things first, let's tackle the fundamentals of forensic medicine and legal processes. Concentrate on medical jurisprudence, discovers the duties and responsibilities of a doctor in legal cases. Indian Penal Code (IPC) sections. Familiarize yourself with IPC sections like 304A, 320, 376, as these are frequently asked about in exams. Inquests. Get a good grasp of the different types of inquests in India, including police, magistrate, and coroner inquests. Legal documents. Learn the essentials of writing medico-legal reports, death certificates, and injury certificates. For this section, Parikh's textbook of medical jurisprudence and toxicology can be a great help. Next, we'll delve into thanatology, the study of death, a crucial aspect of forensic medicine. Key topics to cover include signs of death. Learn to identify immediate, early, and late signs of death, such as rigor mortis and putrefaction. Estimation of time since death. Understand how factors like body cooling, rigor mortis, and postmortem lividity help estimate the time of death. Postmortem changes. Explore the processes of decomposition, mummification, and adipocere formation. Autopsy. Get acquainted with the objectives, types, and protocols involved in medico-legal autopsies. Mastering these topics will equip you to handle case scenarios with confidence. Moving on, injuries and wounds are super important, both for your exams and practical applications. Focus on types of wounds. Be able to differentiate between abrasions, contusions, lacerations, incised wounds, and stab wounds. Mechanism of injury. Understand the mechanisms behind blunt force, sharp force, firearm injuries, and asphyxia. Legal classification of injuries. Learn to classify injuries as simple or grievous hurt from a legal standpoint. Head injuries. Familiarize yourself with skull fractures, brain injuries, and their medico-legal implications. This section is vital for grasping the medico-legal aspects of trauma cases. Now, let's talk about toxicology, the study of poisons. Alright, let's break down ophthalmology, a short but important subject you'll encounter in your third year of MBBS. From cataracts and glaucoma to squint, the subject lays the groundwork for understanding and managing eye diseases. Let's explore what to study in ophthalmology and how to conquer it. First things first, let's start with the fundamentals of eye anatomy and physiology. This will make understanding diseases a whole lot easier. Focus on anatomy of the eyeball, layers of the eye, cornea, sclera, retina, lens, and optic nerve. Physiology of vision, how light is focused on the retina, visual pathways, and pupillary reflexes. Extraocular muscles, their actions and nerve supply. You can brush up on this from your anatomy and physiology textbooks or the first chapter of Khurana's Comprehensive Ophthalmology. Okay, now let's jump into disorders of refraction, one of the most important sections for exams. Key topics include myopia, nearsightedness, causes, types, and management. Hypermetropia, farsightedness, its correction with lenses. Astigmatism, regular versus irregular and its management. Presbyopia, age-related loss of accommodation. Also, get a good grasp on the basics of spectacles, contact lenses, and LASIK surgery. Now, the conjunctiva and cornea are prone to quite a few diseases. Focus on conjunctivitis, types, bacterial, viral, and allergic. Keratitis, causes, clinical features, and management. Corneal ulcers, bacterial, fungal, and viral ulcers and their treatment. Dry eye syndrome, causes and artificial tears. Clinical features and treatment protocols are super important for viva and practical exams. Let's talk about cataract, one of the most frequently asked topics in ophthalmology. Key points to study: types of cataracts, senile, traumatic, congenital, and secondary cataracts. Clinical features: gradual painless loss of vision and glare. Management: surgery, phacoemulsification, extracapsular cataract extraction, ECA, and intraocular lens (IOL) implantation. Make sure you know the grading of cataracts and post-operative complications. Next up is glaucoma, a high-yield topic that's also clinically crucial. Focus on types of glaucoma, open angle, angle closure, and congenital glaucoma. Clinical features: visual field defects and increased intraocular pressure (IOP). Diagnosis: use of tonometry, gonioscopy, and perimetry. Management, medical therapy, like beta blockers and prostaglandin analogs, and surgical options, trabeculectomy. Understand how to differentiate between open-angle and angle-closure glaucoma. Last but not least, the retina and vitreous are essential for vision, and their diseases are often asked in exams. Key topics include retinal detachment, types, symptoms, floaters, flashes, and treatment. Diabetic retinopathy, types, funduscopic findings, and laser treatment. Hypertensive retinopathy, grades and fundus findings. Age-related macular degeneration, ARMD, wet versus dry types and management. Make sure to study fundus examination techniques and their clinical significance. Alright, let's jump into ENT, ear, nose, and throat. ENT, sometimes called otorhinolaryngology, is a pretty important subject you'll tackle during your third year of MBBS. It's all about diagnosing things like ear infections and understanding how vocal cords can have problems. Basically, ENT is full of useful stuff that'll help you out when you are actually working as a doctor. Let's take a look at what you gotta study to rock this subject. First things first, you gotta get the basics of anatomy and physiology down. They're super important for understanding how diseases work. Pay close attention to anatomy of the ear, the external, middle, and inner ear parts, including those auditory and vestibular systems. Nasal anatomy, the nasal cavity, those paranasal sinuses, and how the nasal cycle works. Throat anatomy, the pharynx, larynx, tonsils, and vocal cords. Physiology, how hearing works and how sound travels to your brain. Balance and how the vestibular system plays a role. What the nose does, breathing, smelling, and keeping things humid. Knowing this stuff will make understanding diseases and how to treat them way easier. Let's start with ear disorders. They're a big deal in ENT. Here are the key things to focus on. Otitis externa, what causes it, what it looks like, and how to treat it. Otitis media, the acute, chronic, and secretory types, plus complications like mastoiditis. Hearing loss, conductive and sensorineural hearing loss. Audiometry in those tuning fork tests, Rinner's, Weber's, and absolute bone conduction tests. Vertigo, what causes it in the inner ear versus the brain, especially Meniere's disease. Ear surgeries, tympanoplasty and mastoidectomy. When you are practicing, make sure you know how to use ear instruments and how to do those procedures. Next up, the nose and paranasal sinuses. This stuff comes up a lot in exams, so it's important. Study these. Rhinitis, the allergic and non-allergic kinds. Sinusitis, acute and chronic sinusitis, especially how to read those imaging scans and surgical stuff like FES, functional endoscopic sinus surgery. Nasal polyps, different types, what they look like, and how to handle them. Epistaxis, nosebleed, what causes it, how bad it is, and what to do right away. Deviated nasal septum, DNS, what the symptoms are and how to fix it with surgery, septoplasty. This section is important for both written tests and those face-to-face ones. Now, let's chat about throat disorders, another super important area in ENT. Key things to learn. Pharyngitis and tonsillitis, those acute and chronic infections, including things that can go wrong like quinsy. Laryngeal disorders, hoarseness, vocal cord nodules, and laryngeal papillomas. Obstructive sleep apnea, OSA, how it works, what it looks like, and how to manage it. Tumors, benign and malignant tumors in the pharynx and larynx, especially squamous cell carcinoma. Stridor, what causes it and what to do in an emergency. When you are practicing, get comfy with examination techniques like indirect laryngoscopy and using that mirror. ENT also covers head and neck stuff, which sometimes overlaps with what general surgeons do. Here's what to focus on. Neck swellings, branchial cysts, thyroglossal cysts, and swollen lymph nodes, lymphadenopathy. Salivary gland disorders, cialadenitis, salivary stones, and parotid tumors. Community medicine, or as some folks call it, preventive and social medicine, PSM. It might seem like a low-key subject during MBBS, but trust me, it's a game changer for becoming a doctor who truly makes a difference. We are talking about everything from public health policies to keeping people healthy, basically, the ABCs of tackling community health issues. Let's break down how to conquer community medicine and totally rock it. First things first, let's nail down the basics of community medicine. Here's the deal. Concepts of health and disease. You gotta know how we define health, illness, and how diseases naturally progress. Determinants of health, think social, environmental, and even genetic factors, they all play a part. Levels of prevention. We are talking primordial, primary, secondary, and tertiary prevention, know your levels. Public health importance. Get how our healthcare systems fit into the big picture of improving community health. Once you've got this foundation down, you'll be set to grasp the bigger goals of preventive medicine. Next up, we've got epidemiology, a heavy hitter in community medicine. Here's the lowdown. Epidemiological methods. Wrap your head around descriptive, analytical, and experimental studies. Measures of morbidity and mortality, incidence, prevalence, case fatality rates. Know your way around these terms. Screening. Get a handle on sensitivity, specificity, and those all-important predictive values. Epidemic investigations. What steps do you take when an outbreak happens? Be ready. Bias and confounding. These concepts are your bread and butter for research studies. Don't just memorize, practice working through epidemiological problems. It's like learning to ride a bike, gotta get hands on to really get it. Now, for a subject that can feel a bit like climbing Mount Everest, biostatistics. It's tough but can seriously boost your score in community medicine. Here's the game plan. Data types and presentation, tables, graphs, charts. Learn how to present data clearly. Measures of central tendency, mean, median, mode. These guys are your new best friends. Measures of dispersion, standard deviation and variance. Don't let them intimidate you. Tests of significance, chi-square test, t-test, correlation. Know when to use each one. Sampling methods, random or non-random sampling. Understand the difference. Pro tip, practice, practice, practice those numerical problems. Exams love to throw them your way. Let's talk about disease prevention and control, key for both acing exams and being a fantastic doctor. Communicable diseases. Get up close and personal with diseases like tuberculosis, malaria, HIV, AIDS, and dengue. Pay attention to epidemiology. Know how these diseases spread. Prevention strategies. Think vaccines, sanitation. How do we stop them in their tracks? National health programs. Be familiar with programs tackling these diseases in your country. Non-communicable diseases, NCDs. We are talking hypertension, diabetes, cancer, even mental health disorders. Connect the dots between these topics, lifestyle choices, and how to prevent them in the first place. Last but not least, let's tackle demography and family planning, essential parts of community medicine. Here's the scoop. Demographic cycle. Understand the different stages and what they mean for populations. Population dynamics, fertility, mortality, migration. These factors shape population changes. Family planning methods, from temporary options like oral contraceptives and IUCDs to permanent methods like sterilization. Know your stuff. National Family Planning Program. What are the policies, goals, and how successful has the program been? Remember to weigh the pros and cons of different family planning methods. It's all about informed choices. Alright, let's dive into general medicine. This subject smoothly blends theory and clinical practice, getting you ready to diagnose and handle a wide range of medical conditions. Since the syllabus is pretty massive, knowing what to zero in on is super important. So, let's break down how to tackle general medicine, ace those exams, and build a solid foundation for clinical practice. Before getting into specific diseases, start with the fundamentals of history taking and clinical examination. Here are some key areas. History taking. The patient's chief complaints, what's been happening with the current illness, their past medical history, and any relevant family history. General physical examination. Checking for things like paleness, pallor, jaundice, icterus, bluish skin, cyanosis, clubbing of the fingers, swollen lymph nodes, lymphadenopathy, and swelling, edema. Systemic examination. This includes cardiovascular system, CVS, respiratory system, gastrointestinal system, GIT, nervous system. Make sure to practice examination techniques regularly at the bedside. This will really boost your confidence in your clinical skills. The cardiovascular system is a big deal in general medicine. Here are the key conditions to focus on. Hypertension, how it's classified, what complications can arise, and how it's managed. Coronary artery disease, angina, heart attack, myocardial infarction, and heart failure. Valvular heart diseases, mitral stenosis, mitral regurgitation, and problems with the aortic valve. Congenital heart diseases, things like ASD, VSD, and PDA. ECG interpretation, learning to spot arrhythmias, ischemia, and heart blocks on an ECG. Use your time during clinical postings to practice listening to the heart, auscultation, and identifying different heart murmurs. Next up, the respiratory system. Here's what to study: chronic obstructive pulmonary disease, COPD, and bronchial asthma. Pneumonia, both the kind you get in the community and the kind you pick up in the hospital. tuberculosis, pulmonary, in the lungs, and extrapulmonary, outside the lungs, TB, including how it's treated. Interstitial lung diseases, how they're diagnosed and managed. Lung cancer, different types, how it presents, and treatment options. During ward rounds, really focus on clinical skills like percussion, tapping, and auscultation, listening, of the chest. The gastrointestinal system is huge and super important clinically. Key topics include acid peptic disease, APD, gastritis, gastric ulcers, in the stomach, and duodenal ulcers, in the duodenum. Liver diseases, hepatitis, caused by viruses or alcohol, cirrhosis, and hepatic encephalopathy. Pancreatitis, both acute, sudden, and chronic, long-term. Inflammatory bowel diseases, Crohn's disease and ulcerative colitis. Jaundice, knowing how to tell the difference between obstructive jaundice, hepatocellular jaundice, and hemolytic jaundice. Try to connect these topics with lab tests like liver function tests, LFTs, imaging studies, and endoscopy. Now let's move on to the nervous system. It can be tough, but it's also fascinating. Key topics to focus on: stroke, ischemic, caused by a blockage, and hemorrhagic, caused by bleeding, including how to manage them in the acute phase. Epilepsy, different types and the medications used to treat them, anti-epileptic drugs. Neuropathies, diabetic neuropathy and alcoholic neuropathy. Movement disorders, Parkinson's disease and chorea. Central nervous system, CNS, infections, meningitis, encephalitis, and brain abscesses. Get a good grasp on neurological examination techniques, like cranial nerve testing and assessing reflexes. The endocrinology section is all about hormonal disorders. Here's what to study: diabetes mellitus, how it's diagnosed, the complications that can happen, like DKA and HHNS, and management strategies. General surgery, it's gotta be one of the coolest and most hands-on parts of an MBBS. You are learning how to handle surgical cases from start to finish, figuring out what's up and how to treat it. Whether you are diving deep into surgical anatomy or scrubbing in for a surgery, it's a journey every doctor remembers. Ready to rock general surgery? Let's break down what you gotta know. Before you jump into the nitty-gritty of specific surgeries, you gotta nail the basics. Here are some key topics to cover. Asepsis and sterilization. Think about different methods, how to prevent infections at surgical sites, and overall hospital hygiene. Surgical instruments. You learn how to ID and handle all sorts of instruments, scalpels, forceps, sutures, you name it. Preoperative and postoperative care. Get ready to prep patients, get consent, monitor them after surgery, and handle any complications that might pop up. Wound healing and management. Wrap your head around different types of wounds, how they heal, and what can go wrong, like infections or wounds reopening. Think of these fundamentals as the foundation for everything else you'll learn. Now, let's head up to the head and neck. Here's what you need to know: thyroid disorders, goiters, thyroid cancers, and how to remove the thyroidectomy. Salivary gland disorders, parotitis, inflammation of the parotid gland, salivary stones, and tumors. Neck swellings, how to figure out what's causing those lumps in the neck, differential diagnosis. Oral and facial injuries, managing injuries to the face and jaw. These topics are like exam and viva gold, so make sure you've got the clinical presentations and surgical techniques down pat. Next up, breast surgery. Important stuff to study includes benign breast disorders, fibroadenoma, non-cancerous breast lumps, mastitis, breast inflammation, and gynecomastia, enlarged breasts in men. Breast cancer, risk factors, staging, the TNM classification system, and treatment options like mastectomy, breast removal. Triple assessment, the trifecta of breast cancer diagnosis, clinical exam, imaging, and biopsy. Managing breast cancer is a biggie for exams, so pay attention. Now let's move on to the gut, the heart and soul of general surgery. Focus on peptic ulcer disease, PUD, complications like ulcers that perforate or bleed, and how to manage them surgically. Gallbladder diseases, gallstones, gallbladder inflammation, cholecystitis, and gallbladder removal, cholecystectomy. Appendicitis, diagnosing it, complications like a ruptured appendix, and appendectomy, appendix removal. Hernias, inguinal, femoral, and incisional hernias, know them all. Colorectal disorders, hemorrhoids, fissures, fistulas, and colorectal cancer. Make sure you can connect the dots between surgical anatomy and what you are seeing in patients. Vascular surgery, that's all about blood vessels and what can go wrong. Important topics include peripheral vascular disease, claudication, pain when walking, gangrene, tissue death, and bypass surgery. Aneurysms, diagnosing and repairing those bulges in the aorta, abdominal aortic aneurysm. Varicose veins, why they happen, what can go wrong, and how to treat them surgically. Deep vein thrombosis, DVT, risk factors, diagnosis, and treatment for those pesky blood clots. Pay attention to surgical techniques like angioplasty, opening up narrowed blood vessels, and endovascular repair, fixing blood vessels from the inside. Last but not least, there's urology, another crucial part of general surgery. Key topics to master include urinary stones, kidney and ureter stones, and how to deal with them. Think lithotripsy, shock waves to break up stones, and nephrolithotomy, surgically removing kidney stones. Benign prostatic hyperplasia, BPH, symptoms, diagnosis, and TURP, transurethral resection of the prostate. Alright, let's dive into pediatrics, a super important part of MBBS. It's all about kids' health, figuring out what's wrong, making diagnoses, and getting them better. Keep in mind, treating kids isn't the same as treating tiny adults. Their bodies and minds are still developing, so we gotta think differently. Ready to rock your exams and impress in your clinicals? Let's break down what you need to know. First up, understanding how kids grow and develop is key. Zero in on these milestones. Know the physical, social, and cognitive milestones for each age group: babies, toddlers, preschoolers, and school kids. Growth monitoring. Get comfy with growth charts, how to figure out mid-parental height, and what signs might mean a child's growth is lagging. Developmental disorders. Wrap your head around autism spectrum disorder, ADHD, and learning disabilities. Remember, questions about milestones pop up all the time in exams, both written and viva. Next, we've got neonatology. This is all about newborns and it's super important in pediatrics. Here's the need to know. Newborn resuscitation. You've got to know the steps, what an Apgar score means, and how to care for a newborn in that critical first minute. Low birth weight and preterm babies. Learn how to manage these little ones and be ready for complications like RDS, NEC, and IVH. Neonatal jaundice. Know the difference between normal newborn jaundice and the kind that needs attention, plus when to use phototherapy. Neonatal infections. Be prepared for sepsis, meningitis, and those tricky torch infections. Congenital anomalies. Familiarize yourself with common birth defects like cleft lip, diaphragmatic hernia, and congenital heart diseases. Neonatology is the foundation for pediatric emergencies, so pay close attention here. Now, let's talk about food. Nutrition is a big deal for kids to grow and thrive. Here's the scoop. Breastfeeding. Know the benefits, the right way to do it, and common issues like mastitis. Complementary feeding. When to start, what to feed them, and common mistakes parents make. Malnutrition. Get familiar with PEM, protein energy malnutrition, especially kwashiorkor and marasmus, and how to manage them. Micronutrient deficiencies. Know about deficiencies in iron, zinc, vitamin A, and vitamin D. These topics aren't just about theory, they'll come up in your clinical practice, too. Kids seem to catch everything, so pediatric infectious diseases are a biggie. Focus on these: viral infections, measles, mumps, rubella, chickenpox, and of course, COVID-19. Bacterial infections, pneumonia, meningitis, tuberculosis, and enteric fever. Parasitic infections, malaria and those pesky worm infestations. Immunization. The National Immunization Schedule is your friend. Know the vaccine-preventable diseases and the different types of vaccines. Speaking of, immunization schedules are a sure bet to show up on exams, so make sure you know them inside and out. Let's tackle pediatric respiratory disorders, another common topic on exams. Here are the key players. Bronchiolitis. How to diagnose it and provide supportive care. Asthma. Get familiar with the pediatric asthma management guidelines. Pneumonia. Know the difference between viral and bacterial pneumonia, plus complications like pleural effusion. Tuberculosis in children. How it's different from adult TB, how to diagnose it, and the DOTS therapy. Pay attention to respiratory rates, but you hear when you listen to their chest, and oxygen therapy protocols. Last but not least, pediatric cardiology. It's pretty fascinating stuff. Dive into these. Congenital heart diseases, CHDs. Know the difference between a cyanotic, ASD, VSD, PDA, and cyanotic tetralogy of Fallot. TGA defects. Rheumatic heart disease. This one's important too. Okay, let's dive into the world of obstetrics and gynecology. It's like the ultimate guide to women's health, from pregnancy to childbirth and everything in between. This field is super interesting and practical, covering a wide range of topics from prenatal care to reproductive health. Let's break down what you need to know to rock your exams and feel confident in your clinical practice. First up, let's tackle obstetrics, which focuses on pregnancy, labor, and postpartum care. Here's the rundown. Anatomy and physiology of pregnancy. Get a good grasp on how the fetus develops, how the uteroplacental circulation works, and how hormones change throughout pregnancy. Antenatal care. Learn about routine checkups, important investigations, and how to monitor both maternal and fetal health. Normal labor. Understand the different stages of labor, the mechanism of delivery, and how to interpret a partogram. Puerperium. Familiarize yourself with the changes that happen after delivery and common complications like infections and postpartum hemorrhage, PPH. And don't forget to practice those clinical examination skills, especially Leopold's maneuvers. Next, let's talk about high-risk pregnancies. This is super important for both your exams and real-life practice. Here are the key areas to focus on. Hypertensive disorders. Get to know preeclampsia, eclampsia, and HELLP syndrome inside and out. Gestational diabetes mellitus, GDM. Learn how to screen for, diagnose, and manage GDM effectively. Placental abnormalities. Understand different placental issues like placenta previa, abruption, and accreta. Multiple pregnancy. Know the ins and outs of twin pregnancies and the risks involved. Preterm labor and prom. Learn about the causes, diagnosis, and management of preterm labor and premature rupture of membranes. These topics pop up all the time in exams and are crucial for providing the best patient care. Now, let's explore fetal medicine, which is all about keeping a close eye on the fetus and ensuring its well-being. Here's what you should focus on. Ultrasound in pregnancy. Understand how to interpret biophysical profiles, Doppler studies, and anomaly scans. Fetal growth restriction, FGR. Learn about the causes, diagnosis, and management of FGR. RH isoimmunization. Get a handle on the diagnosis, prevention, and treatment of RH isoimmunization. Congenital anomalies. Know how to screen for and manage common congenital conditions. Fetal distress. Be able to interpret CTG readings and know what interventions to take in case of fetal distress. Having a good understanding of fetal medicine helps you make quick, life-saving decisions for both mom and baby. Let's move on to operative obstetrics, which covers surgical procedures during pregnancy. Here are the key topics. Caesarean section. Know the indications, techniques, and potential complications of C-sections. Episiotomy. Understand when an episiotomy is necessary and how to repair it. Instrumental delivery. Familiarize yourself with the use of forceps and vacuum extraction. Postpartum hemorrhage, PPH. Learn about active management of the third stage of labor and surgical interventions for PPH. These procedures are essential for clinical practice and often come up in vivas, so make sure you're comfortable with them. Now, let's switch gears to gynecology, which focuses on women's health outside of pregnancy. Let's start with the basics. Anatomy and physiology of the female reproductive system. Get a solid understanding of how everything works down there. Menstrual cycle. Learn about normal menstrual physiology and hormonal regulation. Pelvic infections. Familiarize yourself with pelvic inflammatory disease, PID, endometritis, and salpingitis. Contraception. Understand different contraceptive methods, their indications, and potential side effects. These foundational topics are key to understanding reproductive health. One of the most common topics in gynecology is abnormal uterine bleeding, AUB. Here's what you need to know. Causes. Get familiar with the PALM-COEIN classification system, which helps categorize the causes of AUB, polyp, adenomyosis, leiomyoma, malignancy, etc. Diagnosis. Understand how ultrasound and hysteroscopy are used to diagnose AUB. Okay, let's jump into the world of orthopedics. It's all about the musculoskeletal system, bones, joints, you name it. This stuff is super important for your clinical work. Let's break down what you need to know to rock your exams and clinical rotations. First things first, the basics. These are key for understanding anything orthopedic. Bone healing. How do bones heal? What are the different types of fractures and the stages of bone healing? Imaging. You'll need to know how to interpret X-rays, CT scans, and MRIs, especially when it comes to fractures and soft tissue injuries. Splints and plasters. What kinds of casts are there, and when do you use them? Traction. What are the different types, skin and skeletal, and when are they used? Make sure you've got a good grasp on bone anatomy and physiology, it's the core of orthopedics. Now, let's talk about fractures and dislocations. They're a big part of orthopedics. Here's what to focus on. Classification of fractures. You'll need to know the difference between open and closed fractures, as well as transverse, spiral, comminuted, and other types. Fracture healing complications. Sometimes things don't go as planned. Learn about delayed union, non-union, and malunion. Management of fractures. How do you manage a fracture? Understand the principles of reduction, immobilization, and rehabilitation. Common dislocations, shoulders, hips, elbows. Know how to recognize and manage these dislocations. Pay attention to common fractures like Cullis fracture, femur fractures, and clavicle fractures. You'll want to know the clinical presentations and management protocols for these. Pediatric orthopedics is a whole other ball game. Kids aren't just small adults. Here are some key things to study. Congenital Tallites equinovarus, CTEV, or clubfoot. How do you diagnose and treat it? Hint: the Ponseti method is important. Developmental dysplasia of the hip, DDH. Know the clinical signs, like the Barlow and Ottolani tests. Growth plate injuries. Learn the Salter-Harris classification system. Osteogenesis imperfecta. What are the features and how is it managed? These pediatric topics are high yield for your exams and vivas. Let's move on to the spine. It's a critical area in orthopedics. Here's what you should know. Scoliosis and kyphosis. How do you diagnose and treat these spinal curvatures? Prolapsed intervertebral disc, PIVD. You might know this as a slip disc. Spinal cord injuries. What's the acute management and how does rehabilitation work? Tuberculosis of the spine, Pott's spine. Know how it's diagnosed and the role of anti-tubercular therapy, AT. Infections and tumors are important too. Focus on these. Osteomyelitis. What are the acute and chronic types? What are the clinical features and how is it treated? Septic arthritis. How is it diagnosed and managed? Bone tumors. Learn about benign tumors like osteochondroma and malignant ones like osteosarcoma and Ewing sarcoma. Knowing how to investigate these conditions is crucial. Learn about biopsies and imaging techniques. Arthritis is another big topic in orthopedics. Here's the breakdown. Osteoarthritis, OA. What are the clinical features and treatment options, including joint replacement? Rheumatoid arthritis, RA. Understand the pathogenesis, diagnosis, and the role of DMARDs, gout and pseudogout. These are crystal arthropathies. How are they managed? Septic arthritis. How do you differentiate this from inflammatory arthritis? Pay close attention to how you examine a joint for swelling and deformities. Finally, remember that in orthopedics, trauma is common in emergency situations. Alright, let's dive into anesthesiology, the practice of keeping patients comfortable and safe during surgery. We'll break it down like this. 1. Anesthesia 101. We'll cover the different types of anesthesia: general, completely under; regional, numbing a specific area; and local, numbing a small spot. Before surgery, it's crucial to make sure the patient is healthy enough, which is where pre-anesthetic evaluation comes in. We'll also learn about managing the airway, including tools like endotracheal tubes, laryngeal mask airways, and bag mask ventilation. 2. Anesthesia medications. Get to know the common drugs used in anesthesia, like propofol, ketamine, thiopentone, and inhalational agents. We'll also cover neuromuscular blockers, succinylcholine and vecuronium, and local anesthetics, lidocaine, bupivacaine, including how they work and their dosages. 3. Regional anesthesia techniques. This section explores spinal and epidural anesthesia, covering when they're used, how they're done, and potential complications. We'll also touch on nerve blocks, specifically brachial plexus and femoral nerve blocks. 4. Handling complications. Things can sometimes go wrong, so we'll learn about managing complications like malignant hypothermia, aspiration, and hypoxia. We'll also brush up on the basics of CPR and ACLS protocols for emergency situations. Now, let's switch gears to radiodiagnosis, where we learn to decipher those medical images. Here's the plan. 1. Imaging tools. We'll start with X-rays, learning about chest X-rays, spotting fractures, and understanding contrast studies like barium meals. Next up is ultrasound, when it's used, what Doppler studies tell us, and the basics of abdominal ultrasound. Then, it's on to CT scans, why they're ordered, their advantages, and how to interpret a basic brain CT. Finally, we'll explore MRI, its principles, common uses like brain and spinal imaging, and contrast studies. 2. Common medical conditions seen through imaging. Chest X-rays, we learn to identify pneumonia, pleural effusion, and pneumothorax. Bone fractures, time to spot those fractures and dislocations on X-rays. Abdominal imaging, we look at how to identify obstruction, perforation, and problems with the liver or kidneys. Neurological imaging, get ready to learn the basics of identifying stroke, brain tumors, and hemorrhage on CT and MRI scans. 3. Contrast studies. This section delves into contrast agents, but they are and how they're used in studies like IVP, intravenous pyelogram, and angiography. We'll also cover the situations where contrast agents shouldn't be used and their potential side effects. 4. Staying safe around radiation. We'll learn about the ALARA principle, as low as reasonably achievable, to minimize radiation exposure. And we'll cover the protective measures in place for both patients and healthcare workers. To really dig deeper into anesthesiology, check out these resources. 1. Essentials of Anesthesiology by Krishna Bhatt. This one's a great starting point for MBBS students. 2. Morgan and Mikhail's Clinical Anesthesiology. This book is perfect when you're ready to go beyond the basics. For radiodiagnosis, these books are super helpful. 1. Textbook of Radiology for MBBS by Sumer Sethi. It's easy to understand and geared towards what you'll need for exams. 2. Ayer's Basic Principles of Radiology. This one's fantastic for grasping those fundamental imaging concepts. And there you have it, your crash course in anesthesiology and radiodiagnosis for MBBS. These subjects are hands-on, super interesting, and you'll use what you learn every day in clinical practice. Psychiatry is about getting a handle on mental health, figuring out what psychiatric disorders people might have, and helping them live better lives. It's a cool mix of medicine, psychology, and just plain empathy. So, let's dive into what you need to know about psychiatry during MBBS and how to totally rock the subject. Let's kick things off with the psychiatry basics, which are super important for understanding mental health disorders. Zero in on these. Mental Status Examination, MSE, get a grip on how to assess a patient's appearance, mood, speech, thought process, and insight. Classification systems, ICD-11 and DSM-5, wrap your head around how psychiatric disorders are grouped together. Normal vs. abnormal behavior, learn how to tell the difference between everyday behavior and mental illness. Etiology of psychiatric disorders, explore the biological, psychological, and social factors at play. Start with these fundamentals, and you'll find it way easier to navigate the subject. Next up, dive into common psychiatric disorders that you'll see in exams and when you are actually working with patients. This includes mood disorders, depression, bipolar disorder, and how to manage them. Anxiety disorders, generalized anxiety, panic disorder, and those pesky phobias. Psychotic disorders, schizophrenia, get a handle on its symptoms, different types, and how it's treated with antipsychotics. Obsessive compulsive disorder, OCD, how it's diagnosed and the therapies used to treat it. Somatic symptom disorders, conditions like hypochondriasis and conversion disorder. Substance use disorders are a big deal and super common, so make sure you've got them covered. Focus on alcohol use disorder, what alcohol does to the body, withdrawal symptoms, and how to manage it. Dermatology, gotta love it. It's one of the coolest and most visually interesting parts of MBBS. We're talking about the skin, hair, and nails, basically, stuff you see every day in clinical practice. So, let's break down what you gotta know to crush your dermatology exams and rock those clinical rotations. First things first, the dermatology basics. Think of it like building a house, you gotta start with a strong foundation. Structure of the skin, get up close and personal with the epidermis, dermis, and subcutaneous tissue. Skin appendages, hair, nails, sebaceous glands, and sweat glands, know them like the back of your hand. Basic skin lesions, learn how to spot those primary lesions, macules, papules, vesicles, and secondary lesions, scales, ulcers, crusts. Pigmentation disorders, vitiligo, melasma, and hyperpigmentation. Knowing your skin anatomy and those common lesions is like having X-ray vision for diagnosis. Okay, now for the bread and butter, the most common skin issues you'll see. Acne vulgaris, diagnosis, treatment, and what could go wrong. Psoriasis, how it works, what it looks like, and how to manage it. Eczema, atopic dermatitis, chronic versus acute, what sets it off, and how to treat it. Rosacea, diagnosis, the different types, and how to handle them. Fungal infections, tinea, candidiasis, and dermatophytosis. Nail these common conditions, their clinical features and treatment, and you'll be way ahead of the game. Infections, they're everywhere in dermatology. Zero in on these. Bacterial infections, impetigo, cellulitis, and leprosy. Viral infections, herpes simplex, herpes zoster, shingles, and warts, HPV. Fungal infections, tinea corporis, tinea pedis, and candidiasis. parasitic infections, scabies and lice infestation. Learn to tell these conditions apart based on what you see and the right tests to run. Now, let's get serious about skin disorders caused by autoimmune and inflammatory stuff. Key players include lupus, erythematosus, systemic lupus erythematosus, SLE, and discoid lupus. Bullous pemphigoid, how to diagnose it and what treatment options you have. Pemphigus vulgaris, clinical features, diagnosis, and treatment, know it cold. Scleroderma, different types, how the skin changes, and if other organs are involved. Understanding the immune system's role in these diseases is key for cracking exams and being a rockstar clinician. Dermatologic oncology, this one's huge, especially now with skin cancers on the rise. Focus on basal cell carcinoma, BCC, how it looks in your treatment options. Squamous cell carcinoma, SCC, risk factors, nailing the diagnosis, and management strategies. Melanoma, the ABCDE rule, asymmetry, border, color, diameter, evolution, is your best friend for detecting melanoma. Non-melanoma skin cancers, catching it early and what treatments to use. Knowing the signs of skin cancer can literally save lives, so recognizing those early red flags is crucial. Last but not least, hair and nail conditions, an essential part of the dermatology puzzle. Here's the deal: alopecia, androgenetic alopecia, alopecia areata, and how to treat them. Tinea capitis, fungal infections that mess with the scalp. If you found this video helpful, please hit the like button, share it with your friends, and don't forget to subscribe to Chill Medico NEET UG. You can join our Telegram group for any NEET related queries with more NEET aspirants or medicos. Drop your comments or questions below, and I'll be happy to help. Until next time, take care and happy studying. Thank you.